Hi everyone, welcome back to my YouTube channel, and today we are going to talk about osteoporosis. So let's start our topic with introduction. Osteoporosis is chronic bone disease that is characterized by reduced bone density and structural deterioration of bone tissue, thus leading to fragile bone and increased risk of fractures. It is often referred as silent disease because bone loss occurs gradually and without symptoms until a fracture happens. Most common fracture sites include hip, spine, and wrist. Osteoporosis is a major public health concern, especially among postmenopausal women and elderly. Causes and risk factor. First is aging, as bone density naturally decreases with age. Second is hormonal changes, as reduced estrogen in women after menopause and low testosterone in men contribute to bone loss. Third is genetics, as family history of osteoporosis increase the risk. Fourth is lifestyle factors like poor diet that includes low calcium and vitamin D, smoking, excessive alcohol intake, and lack of physical activity are the risk factors for osteoporosis. Fifth is medical conditions and medications, as long-term use of corticosteroids, thyroid disorders, and certain chronic illness can accelerate bone loss. Pathophysiology. Bones are dynamic tissue that undergo continuous remodeling. In osteoporosis, bone resorption by osteoclasts outpaces bone formation by osteoblasts. This imbalance leads to thinning of bone outer shell and enlargement of space within the bone's internal structure, making bone weaker and more prone to fracture. Symptoms of osteoporosis. It is often asymptomatic until a fracture occurs. Common signs include sudden fracture from minor falls or injuries, loss of height due to vertebral compression fractures, stoop posture that is also called as kyphosis, and chronic back pain from spinal fractures. Diagnosis of osteoporosis. First we can do is bone mineral density test that includes dual energy X-ray absorptiometry and it is the gold standard for osteoporosis. Second we can do is clinical evaluation, that is assessment of risk factor and history of fractures. Third we can do is laboratory tests that may be used to rule out secondary causes of bone loss. Treatment and management of osteoporosis. First we can give medications. In medication we can give bisphosphonate that reduce bone resorption. We can give hormone related therapy like estrogen and selective estrogen receptor modulators. We can give denosumab, that is monoclonal antibody, and teriparatide that stimulates bone formation. We also recommend patients for lifestyle modification that include adequate intake of calcium and vitamin D, weight bearing and muscle strengthening exercise, and smoking cessation and limiting alcohol. We can also do for the patient fall prevention strategies like home safety measures to reduce fracture risk. Prevention of osteoporosis include balanced diet that is rich in calcium and vitamin D. It includes regular physical activity, especially weight bearing exercises. It includes avoidance of smoking and excessive alcohol, and routine bone density screening for high risk individuals, especially women over 65. Prognosis of osteoporosis. Osteoporosis is a lifelong condition but can be managed effectively. Early detection and treatment reduce fracture risk and improve quality of life. Without intervention, fractures can lead to disability, loss of independence, and increased mortality. Conclusion of this lecture video. Osteoporosis is silent yet serious condition that weakens bone and increases fracture risk. With proper prevention, early diagnosis, and effective treatment, individuals can maintain bone health and reduce complications. Public awareness, lifestyle changes, and regular screening are key to combating this widespread disease. And this was all about osteoporosis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.